Doctor, thank you very much for joining us this morning. How serious is this?
It's really early days in this epidemic. We're seeing hundreds of cases, more than a dozen deaths, spread within healthcare facilities, spread to multiple countries. So it's quite concerning, but there are two key things that we don't yet fully understand. First, how contagious is it? And second, how deadly is it? If you look at coronaviruses, they range from causing something like the common cold to something as deadly as SARS. And we just don't know yet where this one fits on that spectrum.
So, Doctor, if that's the case, liken it. How much of a blueprint can we use in the recent instances over the past 20 years for things like SARS or Ebola? Are those the right strategies? Can we use those as roadmaps to tackle what we need to do with this particular coronavirus in Wuhan?
There are a few things that we know rock solid need to be done. First, we need to get more information, have a sense of how many total cases there are, how they've been spreading, and what the risk factors or the things that make it more risky for people, older, underlying conditions, healthcare workers, so we can understand more about how it's spreading, who it's spreading to, so we can help stop it. Second, there are really important things that individuals can do that can make a big difference. First off, simply wash your hands regularly. Second, cover your mouth and nose when you cough or sneeze. And third, if you're sick, don't go out. For Wuhan specifically, and any other place where this virus begins spreading, because it is likely to spread to more countries and more places, it's important to restrict travel there, particularly for people who are elderly or who have underlying health conditions and might be severely ill if they became infected.
All right, and Doctor, before we let you go, we know that during the recent Ebola outbreak, there was a fairly large mobilization of the biotech and drug pharma community to try to find ways to cure or create vaccines for it. How closely will U.S. regulators be working with companies on that front? We do know that Moderna already said that they're working with regulators on trying to come up with a vaccine.
There's some products that make a big difference. One of them is simply face masks. This is very important for anyone who's not feeling well to wear. It's a common cultural trend in Asia to see people with face masks if they're not feeling well. And the studies, rigorous scientific studies that have been done, suggest that that does actually reduce the spread of disease. So it's a habit that might spread. But in terms of either a vaccine or treatment, these are probably a ways away. And it's early days yet to understand how likely it is that this is going to be an effective means to curtail this outbreak.